This is WRAL News.
We're taking this, hard ourselves, and that's why we're doing everything that we're doing to really ensure quality for all of our clients.
Right now at 6, a local birthing center looking for answers after recent deaths during delivery. We're glad you're with us tonight. I'm Catherine Brown.
And I'm David Crabtree. 3 recent baby deaths and another baby in intensive care right now. Following the latest troubled delivery, a high-end birthing center in Cary is sending expectant mothers to the hospital to give birth. WRAL Investigates' Cullen Browder has been gathering details for weeks, and tonight speaks exclusively with the center's clinical director, Cullen.
David and Catherine, Baby and Company has 6 locations in North Carolina, Tennessee, and Colorado. The company and birth centers in general have a good record for safe outcomes. But at this Cary facility, 3 babies have died just since October. Another was recently sent to intensive care. And that's when Baby and Company in Cary suspended future births to investigate what is behind this troubling trend.
I think we have clients that are sort of naturally curious about what the options are.
At first glance, Baby and Company in Cary appears to be the poster child of the natural birth center movement.
We also have comfort elements in the rooms.
Certified nurse midwives guide women through the miracle of birth in a home-like supportive setting within a stone's throw of Wake Med.
Most all of our clients, 90% of them, would do this again or recommend it to a friend.
Beyond glowing testimonials, though, is a highly unusual stretch of newborn deaths. Out of 1,200 Baby and Company reported births at this location, WRAL Investigates confirmed 4 babies died shortly after delivery. 1 in 2015, then another last October, 1 last November, and another in February.
How do you explain that?
We have had a cluster of difficult cases here in Cary, and we are concerned about that.
Dr. Margaret Buxton, herself a certified nurse midwife, is clinical director for Baby and Company.
I can't speak to any details, but I can reassure everybody that quality is the heart of what we do. Safety is at the heart of what we do.
She tells us the Cary Center is currently diverting all clients to Wake Med for births, where midwives have full privileges. The decision to pause and investigate was made after another newborn went into distress earlier this month and was transported to Duke's neonatal intensive care unit.
Clustering of cases in healthcare is difficult, but it happens in a lot of different settings. It happens in hospitals, it can happen in birth centers, and when it happens, it's an opportunity for any healthcare organization, and we're including ourselves in that, to take a step back.
Similar diversions and investigations took place after the deaths in February and November, but the center resumed deliveries within weeks. Buxton tells us 1 nurse midwife resigned, and all procedures are under review.
Have protocols changed at all?
We're still in review. And clustering is challenging.
Do you feel you've been upfront enough with your clients about what's happened?
We absolutely have, and what we're doing is we're listening to them and we're talking to them.
At this point, in your heart of hearts, is this just an unfortunate coincidence, or we've got a problem here?
We want to know the answer to that question.
A state lawmaker tells us an internal review at a local birth center is not enough. In fact, he wants the state to investigate 3 newborn deaths in recent months. WRAL launched our own investigation last month. Cullen Browder is here now with the update. Cullen?
David, after a string of deaths and another newborn landed in intensive care, Baby and Company in Cary diverted expectant mothers to deliver at Wake Med. By law, there's very little oversight of birth centers here in North Carolina, but at least one lawmaker wants the state to get involved here. No matter the past birth center safety statistics, 3 newborn deaths in just 5 months raises questions.
My reaction was immediate concern.
So State Representative Nelson Dollar called on the Department of Health and Human Services to investigate Baby and Company's Cary location.
The General Assembly, as well as the public, need to know the answers. We need to know what has happened.
Birth centers like Baby and Company are accredited and employ certified nurse midwives. But under the law, DHHS has no direct oversight.
I believe if they make the request that Baby and Company will comply with that request.
In a statement, Baby & Company responded, quote, "We operate all of our centers to the same high safety and quality standards in every state we operate, many of which have specific birth center regulations in place. We welcome the opportunity to share our complete care approach with lawmakers and state health care officials."
Sort of naturally curious.
Last month, Baby & Company's clinical director confirmed a delivery pause and internal investigation, the third since November.
Clustering of cases in healthcare is difficult, but it happens in a lot of different settings. It happens in hospitals, it can happen in birth centers, and when it happens, it's an opportunity for any healthcare organization, and we're including ourselves in that, to take a step back.
Dollar says it's clear another step back isn't enough.
Their previous investigations were clearly not sufficient to address the problem.
The focus of a WRAL investigation is now part of a push to change state law. Birth centers are not currently regulated by the state. A new bill filed this week in the General Assembly seeks to change that. WRAL's Cullen Browder joins us now with some background on this issue. Cullen?
Well, Deborah, it's Senate Bill 798, the Birth Center Licensure Act. It seeks to add extra layers of safety for facilities that are currently not regulated by the state. And the timing of this bill is not coincidental. In March, Baby & Company in Cary diverted all births to WakeMed after the deaths of 3 newborns in just 5 months, and another case that sent a baby to intensive care. Baby & Co. is part of a growing trend to provide more intimate options for low-risk pregnancies, but the deaths are startling.
State regulators say there is a lack of oversight at a Cary birthing center where 3 babies died since last fall. This is an update to a WRAL investigation.
And our reports on the Cary location of Baby & Company. DHHS stepped in to inspect the location. Their report, just released in WRAL, Sloan Heffron spent the last hour reading it. She joins us now to tell us what it says. Sloan?
This 30-plus page report identifies significant, serious concerns with Baby & Company Birthing Center. The state found problems with medical oversight and supervision of nurse midwives, the criteria used to admit and discharge patients, after-hour staffing, lab operations, documentation, as well as staff training and orientation. Now, 3 babies have died at this birthing center. Following a WRAL investigation, the birthing center agreed to a voluntary review of their operation by the state. That's because the state does not have the authority to regulate birthing centers or impose any fines or penalties. Medicare and Medicaid does have some authority over the lab at the center, and we have now learned that the federal government is working with the state on a separate investigation into this center. We have also learned that the state has been notified of another incident of, quote, potential concern involving a patient of Baby & Company of Cary. In a statement, the state said, quote, "We take seriously the health and welfare of all mothers and babies and are investigating this incident." They went on to say that they have requested access to Baby & Company's records about this latest incident and will follow up with an on-site investigation. And we will continue to follow up as well and bring you any new information as we get it.